Welcome to your benefits orientation with Shared Medical Services. I'm Melinda Crawford, HR Generalist and Benefits Specialist, and I will be taking you through this presentation. Upon meeting eligibility requirements, full-time SMS team members may participate in our comprehensive benefits package. This presentation will help guide you through the available plans and also includes clickable links to access each provider website. I will be reviewing your voluntary benefit options such as health, dental, vision, and life insurance, as well as providing information about our employer-paid benefits and retirement plans. You will have 30 days from your full-time employment date to make your election choices. You will receive an email with electronic copies of the benefits documents within your first day of full-time employment. This email will contain instructions on how to make your elections in our payroll and benefits system, ADP. Additional information can also be found on the SMS portal. Coverage for all of your benefits elections will begin the first of the month following the 30-day waiting period. First, we will discuss the glossary of common insurance terms that will be referenced throughout this presentation, and then we will discuss details on the available benefits. The following slides contain important terms we will be using throughout this presentation. The terms are in alphabetical order and will hopefully provide you with a deeper understanding of your benefits. Feel free to pause the presentation so that you can take time to read each definition at your own comfortable pace. First, some common insurance terms are allowed amount, or often called eligible expense, payment allowance, or negotiated rate. Balance billing is the difference between the provider's charge and the allowed amount. Coinsurance is your calculated percentage cost of the allowed amount of a service. Shared medical services coinsurance is mostly 20%, and the insurance covers 80%. A claim is a statement that the provider sends to the health insurer. Claims for shared medical services are sent to Oxient to process. Co-payments are the fixed amounts that are paid when receiving medical care or prescriptions. Shared medical services only has copay amounts for prescriptions and emergency room visits. You can look at the summary of benefits coverage document for those details. A deductible is the amount owed for healthcare services that team members must pay before the plan pays. For example, the Silver plan has a $1,000 per individual deductible, which is the out-of-pocket cost that must be paid before the insurance will pay anything towards the claim. Routine doctor visits are considered preventative and are covered at 100% if using an in-network provider. Once a claim is processed, Oxient will send an explanation of benefits, or EOB, to explain the services that are being paid by the plan, as well as the amount that will be owed by the patient. These documents are not a bill, and it is recommended to hold on to them at least until the bill from the provider is received. Then you can compare the patient responsibility amount due with the bill, and the EOB will also show year-to-date totals that have been paid toward deductible and out-of-pocket limits. It is very important to use providers that exist within your designated network. The network consists of facilities, providers, and suppliers that SMS has contracted with to provide healthcare services. Your in-network and out-of-network coinsurance amounts are separate. We talked about coinsurance in the previous slide, which is the portion you pay for medical services, but in-network coinsurance costs you less than out-of-network coinsurance. Out-of-network providers do not contract with the SMS plan. The out-of-pocket limit is the most you could pay during a policy period before the plan begins to pay 100% of the allowed amount. There are different out-of-pocket limits set for in-network and out-of-network services. This amount does not include your premium, balance billed charges, or services that are not covered by insurance. This amount does apply to the deductible, prescription copays, and coinsurance amounts that have been paid. The SMS medical plan is a PPO, or Preferred Provider Organization. This is a plan in which hospitals, physicians, and other providers agree to discount rates for a designated network for an insurance company. The insurance contracts that are set within a PPO reimburse at a higher amount if you utilize in-network providers. A premium is the amount team members will pay to obtain or maintain health coverage. SMS takes biweekly deductions from your paycheck to pay for these premiums. A provider is a hospital, pharmacist, nurse, organization, institution, or physician in your location. The term provider is used to identify individuals or facilities that provide health services. Now that you have a better understanding of common insurance language, the next slides will provide details on our specific plan offerings. Regular full-time team members are eligible to elect medical, dental, and vision insurance. Shared Medical Services also provides flexible spending options for medical independent care. In addition, we provide employer-paid basic life, basic accidental death and dismemberment, and short-term and long-term disability insurances at no cost to you. Additional life and AD&D insurance can be elected by team members as well. Shared Medical Services maintains our own self-insured health plan as opposed to purchasing a fully insured plan from an insurance carrier such as Blue Cross Blue Shield, for example. Oxient is our third-party administrator and is the name you will find on your health insurance cards. Oxient performs managerial and clerical functions for the administration of our self-funded benefit plan. They work with networks, develop forms necessary to administer to the program, adjudicate claims and process benefits, determine eligibility and enrollment, and also communicate with networks and provide you with the customer service. Shared Medical Services offers two different medical plans called the Silver Plan and the Gold Plan. The Silver Plan has lower premiums with a higher deductible and out-of-pocket, and the Gold Plan has a lower deductible and out-of-pocket with higher premiums. We will review the premiums later in this presentation. It is important to note the differences in savings when you utilize in-network versus out-of-network services. If the doctor, hospital, or healthcare facility you visit is part of your network, you will generally receive healthcare at lower prices. If you go out-of-network, your healthcare costs will likely increase significantly. In-network and out-of-network services contain separate deductibles and out-of-pocket limits. Think of it like two buckets. In-network providers get paid from one bucket, and the out-of-network providers get paid from the other. Now let's discuss some examples of services you may need to better understand the possible associated costs. In-network providers will cover 80% of insurance claims after the deductible is met, and out-of-network providers cover 60% of claims once the deductible is met. The 20% and 40% coinsurance that is listed is your share of the payment for the medical services provided to you. Your services will be billed as a claim. There is also a $75 copay for emergency services in addition to the coinsurance amounts. We have a 4-tier prescription plan with copays. Copays are fixed costs, and in our plan, generic drugs cost $10, preferred brand name drugs cost $30, and non-preferred brand name drugs cost $50. Our 4th tier is for specialty drugs, and they cost 20% of the retail value to a maximum of $250 copay. Our SBCs, or Summary of Benefits Coverage document, provides information for mail order and limitations as well as exceptions on these tiers. Please contact the HR department if you require a drug formulary to distinguish what tier your prescriptions may fall. Preventive services are 100% covered by insurance for in-network claims under the regulation of the Affordable Care Act, also known as the ACA or Obamacare. Services include annual routine well care, such as an annual visit with your preferred care provider, or PCP, annual vision exams, flu shots, and routine surgeries. There is a $75 maximum coverage per year per individual for the vision exam, but these services can include refractions, contact lens fittings, and glaucoma testing. We also offer a separate voluntary vision insurance to help with your eyeglass, contact lens, and other vision costs. We will discuss the vision insurance shortly. Included with our medical insurance, Teladoc Services provides 24/7 physician consultation over the phone or mobile app. This allows you to access quality care for certain health conditions over the phone, which saves you the time and money required with office and ER or urgent care visits. This added benefit is available to medical plan members at no cost. There is a flyer in your new hire materials that contains some more information. Biweekly premium costs for the Silver and Gold plans are listed here. Premiums are deducted each pay period on a pre-tax basis, up to 26 pay periods per year. This means that contributions are taken out of your paycheck before taxes are applied, and this results in a reduction of your taxable wages. As we discussed earlier, medical plans utilize networks. This slide contains the shared medical PPO network listing. Preferred provider organization plans allow you to visit whatever in-network physician or healthcare provider you wish without requiring a referral. These networks are based on the state you live, and if your state has an asterisk in this list, you have more than one option for a network. Pay close attention to the counties that are listed, and contact the HR Benefits Department if there are any questions regarding your network. You can use the links in this presentation to visit each network website and search for providers to determine if your own doctor is in your preferred network or to search for another. You have flexibility to visit providers, hospitals, and facilities outside of your network. However, keep in mind that visiting an out-of-network provider includes a higher fee and separate deductible. Shared Medical Services has a working spouse provision in place. This means that a team member's spouse who has his or her own offer of coverage with his or her employer is not eligible on the SMS plan. Dependents through age 26 are eligible for medical coverage regardless of student status, marital status, employment status, or other available coverage or residence. Oxient will be contacting team members after insurance election and on an annual basis to confirm spouse eligibility. They will be mailing working spouse provision forms to your home address within a month of enrollment. Please be sure to complete this form within the deadline listed, or there may be a delay of claims being processed and potential denial of claims. Delta Dental is the provider for our dental insurance. The working dependent spouse provision does not apply. However, coverage eligibility varies slightly for the dependents. The child is covered to age 26 only if he or she is a full-time student. Otherwise, there is coverage up to age 19. Premiums are listed per pay period, and these are also pre-tax deductions that take place during payroll. Preventive services such as annual visits and cleanings are covered at 100%. There is an annual deductible of $25 per individual or $75 per family. Our late entrant option allows for annual enrollment if you do not elect this benefit when you are first hired. You can use the link in the presentation to find providers for dental services and see if your own dentist is in the preferred network. Delta is also the carrier for our vision insurance. However, iMed administers our vision insurance on behalf of Delta Vision. Like our dental insurance, the working dependent spouse provision does not apply. Coverage is also available to dependents through age 26, regardless of student status. If you choose to use the Access Network for vision benefits, you can find a provider by clicking the links in this presentation. Glasses and contacts cannot be purchased within the same year, and annual eligibility is based on the last date of purchase. Task is the administrator for our flexible spending plans. The Healthcare Flexible Spending Account is used for eligible medical, dental, or vision expenses that are not covered by insurance. You can use an FSA for copays, bills, glasses, contacts, prescriptions, and any other related expenses. The enrollment materials you have also contain a document with a list of eligible expenses. There is also an FSA option for dependent care, which allows for daycare services for children under the age of 13, as well as disabled adult children, spouse, or relatives. Contributions for FSA are also collected bi-weekly on a pre-tax basis through payroll deduction. The Shared Medical Services FSA plan allows for a grace period after December 31st of each plan year. Those who elect an FSA plan can incur claims to apply to current year funds all the way through March 15th of the following plan year, and they can submit reimbursements for claims not paid by an FSA card through March 31st of that year. After March 31st, funds are forfeited. Team members that elect an FSA get a debit card to use for eligible expenses. These cards will be sent directly from Task to your home residence. Shared Medical Services provides some employer-paid benefits at no cost to you, and you are automatically enrolled. All eligible full-time team members receive voluntary life and accidental death and dismemberment insurance coverage at an amount of 1 times your annual salary to a maximum of $50,000. Shared medical services also offers spousal coverage of $10,000 and dependent coverage of $5,000 to age 19 or 26 if a full-time student. Shared medical services also provides short and long-term disability insurance. Short-term disability maximum period of payment is 13 weeks, and long-term disability pays out afterwards. Short-term disability pays benefits based on weekly earnings, and long-term pays benefits based on monthly earnings at 60%. Both benefits are paid directly to the team member from the insurance carrier, Unum. SMS promotes an appropriate work-life balance, and therefore we offer an Employee Assistance Program, or EAP. The EAP offers services such as assistance in locating child care and elder care, financial assistance, will preparation, as well as access for videos, online seminars, and guides for services that you may need. The EAP also has travel assistance, which provides services such as emergency evacuation, help in replacing passports or prescriptions when traveling. There are 2 wallet cards that are provided with your new hire enrollment materials. Please be sure to hold on to them. Team members also have the opportunity to purchase additional life and accidental death and dismemberment, or AD&D insurance. Premiums for these additional insurances are deducted bi-weekly through payroll. Team members can elect increments of $10,000 to a maximum of the lesser of 5 times your annual salary, or $500,000. Spouses may elect increments of $5,000 to a maximum of the lesser of team members' total election, or $500,000. Dependent children can have coverage in increments of $2,000 to a maximum or the lesser of the team member's total election, or $10,000. Our annual enrollment period occurs generally in November or December of each year, and during this time, team members can make changes to their elections or elect for the first time. No medical underwriting is needed for AD&D, which means no additional medical history is needed to have these elections approved. For voluntary life insurance, rates are based on an age range or age band as listed here. Team members can elect increments of $10,000 to a maximum of the lesser of 5 times your annual salary, or $500,000. Unlike AD&D, there is a guarantee issue amount for this insurance. This means that team members can elect up to the guarantee issue without requiring medical underwriting or requiring a full medical history. The guarantee issue amount for team members is $150,000. Spouses may elect increments of $5,000 with a guarantee issue of $25,000, and dependent children can have coverage of increments of $2,000 to a maximum of $10,000. Annual enrollment takes place in November or December each year with AD&D, and during this time, team members can make changes to elections or enroll for the first time. If voluntary life insurance is not elected within your first 30 days of hire, an evidence of insurability form must be submitted for all new enrollees, even if electing under the guarantee issue amount. Again, here are the age band amounts and an example of a team member who is hired at age 40. For your convenience, ADP does this calculation for you when you elect your benefits. SMS sponsors a retirement savings plan. A 401k plan allows for you to save and invest portions of your paycheck before taxes are taken out. Knowing how to build your 401k retirement plan, devising investment strategies, and making the most of your plan all help to financially secure your path to retirement. Fidelity offers an advisory portfolio service that you can use to manage your 401k. Your enrollment materials have information for this service. Eligibility begins after 6 months of service, and Fidelity will contact you by mail when you are able to start your deferrals. If you choose to contribute to the 401k plan, you will be eligible for the annual employer match. Shared Medical Services matches 100% of contributions up to 4%, and they get applied toward our employee stock ownership plan. We are proud to be a 100% employee-owned organization. An ESOP is a retirement plan that is designed to promote team members with an ownership interest in shared medical services by investing in company stock. By meeting eligibility requirements for our ESOP, you become an SMS owner. Team members are provided with such ownership with no upfront cost. Team members become eligible to participate upon completion of 1 year of service, 1,000 hours, and after reaching age 21 or older. More information regarding the ESOP can be found on the SMS portal under the ESOP tab. There is a very helpful video that can be watched to explain the process. In summary, you have 30 days from your hire date to complete your online enrollment through ADP for all of your benefits, including medical, dental, vision, task flexible spending, and Unum benefits, such as voluntary life and accidental death and dismemberment. There is a 6-month waiting period following your hire date to enroll in the Shared Medical Services 401k retirement plan. Fidelity will contact you by mail when you are eligible to start deferring. ESOP enrollment is automatic, and enrollments take place in either January or July after following your eligibility requirements. Future enrollment opportunities may be available due to a qualifying event, and more benefits information is available on the SMS portal and ADP, including summary plan descriptions, member certificates, and links to benefit plan websites. Additional information on the ESOP and 401k are available on the portal as well. We welcome you to the SMS team, and we are happy to have you here, and if you have any questions regarding our benefits, please contact the HR department. Thank you.